All right, let's go on. Next one on the list is, people are always enamored with Europe, so let's talk about the French healthcare system. This is fun. I didn't realize that. I didn't read it in detail before preparing for this talk. Now that I have, whenever these people say they want a healthcare system, I'm going to say, yeah, let's have France. Because what is the French system? Well, the French system, obviously there's a bit of this where people pay in dollars to a cooperative. They've talked about this idea about creating cooperatives. That's actually what they do in France. They pay into a cooperative, and then the doctor will have a price for what he does. So my office visit's $50, and let's say the cooperative pays $30, okay? Or one doctor might charge $40, or one doctor $20, or whatever it is. You pay the doctor, then you apply to the cooperative for reimbursement. So what does that do for us? Number one, it eliminates the price controls on physicians so that you don't have to worry about not being able to see a doctor. And the other thing it does is if you're really, really good, it's silly in America because every doctor gets paid the same price. It doesn't matter how bad you are, how good you are. Somebody who's really, really good deserves to be paid a little extra. Somebody who's really, really bad does not deserve to be paid the same thing. Okay? But that cooperative takes all that out of play. The other thing is it fixes our Medicare. We're always worried about fraud in Medicare and Medicaid. Pretty much eliminates it because you really can't get a service that the doctor didn't provide because you're paying the doctor directly. It fixes privacy because the doctor doesn't have to submit your records to anyone. You can keep them separate because you pay the doctor and then you submit yours for reimbursement to the cooperative. All right. So basically, then you move on to hospitals. There's actually two kinds of hospitals. They function the same way. There's a public hospital that agrees to take whatever the reimbursement is that's set by the government. There are private hospitals which charge extra. So you would pay the hospital, and if the hospital is $400 a night for the room and your reimbursement is $350, you have to come up with the extra. As you go through that, you see that France has everything that Mr. Obama hates. Significant cost sharing. So you're still paying like 10 to 40% co-payments on top of what you're being reimbursed. It has no price controls on everything. It basically is a voucher system that we're going to support a basic level of care, and if you want extra, then you buy it on your own. Well, that's a two-tier system, which is what they adamantly oppose publicly, yet they keep saying, oh, we got to have a French-style system. Remember, France was rated #1 in the world. This was the greatest place, so here's working out pretty. That thing is going to shoot me, I think. So we have this French system, which is two-tiered, voucher-based, no price controls, and it's sold as the greatest thing in the world. Now, what's the difference between the public hospitals and the private hospitals? Well, the public hospitals have less money available for technology. The private hospitals have a little extra money, so you might be able to get a little bit fancier technology than you would at the public hospital. In the end, people have choice. They can figure out where they want to go, what they want to do. If something is not reimbursable through their cooperatives, then the people can say, okay, I don't get reimbursement, but I really want this. I'm going to go buy it myself. In America, with our system, the way it is set, if Medicare says you can't have it, then you can't have it. And it's a crime to kind of go out of the system. So you have to be careful about those things. So France has all these things that actually would help make us a little bit better, but our bill does not have that at all. All right. So I'm going to skip. I'm going to go through a couple of things that are this 47 million uninsured. Actually, if anyone wants to look at it, I have the Census Bureau that's based on, and what you find is that there's not 47 million uninsured people that are just, in poverty and cannot pay for their health care. 9.7 million are illegal immigrants, and there's no program in the world where they're actually going to get insurance. Now, the law will mandate that hospitals take care of them if they're sick at the hospital, which is fine, but there's no program they're ever going to create politically that's actually going to say, okay, this is insurance for the illegal immigrants. Next, you have about 25 million of that 47 million that are aged 35 or less. That's the young people. They say, I'm not likely to need this. I'm not going to spend this much money per month for health insurance. You also have about 9.7 million of this people that earn more than $70,000 a year, 50 to 70,000, so they have plenty of money to do it. They might be a little bit older, but they've once again said, you know, it's not worth it. I'm running my business, and I'm just going to cut that cost there because I need the money for this other thing. So when you break it down, you really only have about 10 million people that are truly low income, hardcore, uninsured, and they might be chronically ill. Something's going on. So what Mr. Obama plans is to disrupt the entire system of medical care for 300 million people to benefit these 10 million people. You'd think there'd be a better way to do that. All right, now let's talk a little bit about make sure everyone understands how the finances work. Right now, as I said earlier, the average family will get about $12,000 for an insurance policy during the year. All this money goes to the insurance company. Part is the employer. Now, is that working? Yeah. Okay. Part is say about $9,000, $10,000 comes from the employer. $2,000 or $3,000 is out of your pocket. Remember, you've now spent $2,000 to $3,000 just for the privilege of calling yourself insured. This doesn't pay a dime of anything. When you now get sick, now you have to add your co-payments into this. So now you got more on top of the $2,000 or $3,000 that you're putting in with your employer. You're now putting in money for co-payments for physician visits, for medicines, for tests, whatever it is that you have to pay co-payments for. This then adds up, and a lot of times this insurance doesn't even have the cap. I mean, you get 20. I have a friend that had heart surgery. His out-of-pocket expenses with health insurance were like $25,000 because there's just no caps anywhere. Whereas a high-deductible plan, hard cap. So, everyone understand that concept, that there's a lot of money out there being paid on your behalf. Everyone clear? Yeah. Okay.
No, explain that again.
There's always one in the crowd.
One speaks up.